for other participants. And this is Dr. Gourav Rajput from Madhya Pradesh, right? The heart
Yes,
of India.
yes, sir.
So you are the last INASS topper. Your rank is around 22, and now you joined as a surgical gastroenterology resident in AIIMS Bhopal, the place where you worked previously post MS.
Yes,
Very proud moment for us. Actually, it's a hard work and patience, more of a perseverance to work hard and reach that goal. And very happy for you. And this is a session mainly focused on the upcoming aspirants who are very much eager to take a seat in INASS surgical gastroenterology. And we thought, me and Dr. Dibagar and everyone thought we can have the session with you. Then we could have the more idea about which topics or which chapters we should concentrate more, or what is the strategy to prepare. What is your strategy? So hardly around 2 months more for the exam. So provisionally it is April 27th. So you just share your thoughts, and before that you just mention your MBBS college and PG college, followed by whatever hurdles or whatever thing you crossed before this INASS. So let's welcome and please share your thoughts. Thank you.
yes, sir. Sir, first of all, I would like to thank you, sir, for inviting me here.
Yeah,
Sir,
my pleasure.
basically, sir, I belong to the Madhya Pradesh. I did my undergraduate from GR Medical College, Gwalior, in MP itself. And after that, I have completed my MS General Surgery from Gandhi Medical College, Bhopal, in the year 2020. And after that, I have completed 1 year senior residency in the year of 2021, which is my state sponsor. And sir, in the year 2022, I have worked as a non-academic senior residency in the surgical gastroenterology AIIMS Bhopal, where I have joined as an academic assessor now. So, sir, meanwhile,
So
during my
you decided surgical gastro is your dream seat.
no, sir, before joining this senior residency in AIIMS Bhopal as a non-academic, before that, I was not very sure about the surgical gastro. I have confusion between the urology and the surgical gastro. So meanwhile, during my residency in the same department, I have developed keen interest toward the surgical gastro during my non-academic senior residency. So after that, sir, I resigned the job after a period of 5 months in the department. Then after that, I sir, essentially started preparing for the surgical gastro from the May 2022. So after that, I didn't work anywhere, sir. So I was preparing for both the NEET SS and the NESS part. So, sir, I have appeared in the November November NEET SS 2022, where I secured not that good rank. My rank was 1143. So after that, sir, I have appeared in the November NESS 2022, so where I was only qualified, sir. So after that, I stick to my preparation. I didn't join anywhere. So I appeared again. I've decided to start again. So and in the April NESS, sir, I qualified and appeared for the interview also, but I missed by 2 ranks. So and sir, after that, I switched to the NEET SS. Then where I got 440 rank in the NEET SS. So, but I was not getting my dream college, so I was continuing my preparation after the NEET SS because at that time, sir, 1 month was left for the NESS, even less than 1 month. So I stick to my preparation, and so sir, I secured a rank of EML 22. So I got this college, AIIMS Bhopal.
Super, super, super. And my doubt is there any difference between NEET SS preparation and INASS preparation? So because you got only less than 1 month post
Yes,
NEET SS, right?
yes, sir.
So what did you do in less than 1 month period after NEET SS and
Sir,
before
first of all,
INASS?
sir, I would like to say that if we hear the mistake what I did because I was preparing for both the exam NEET SS. It's the thing is that we have to be on one side, either NESS or NEET SS. It can't be possible that we can study for both the exams. Your rank will be suffer, sir. So that was the mistake I was doing in my preparation. So it took me 2 years to crack this exam, sir. So we should have a clarity that where we want to go, whether for NESS or NEET SS.
Okay.
So this should be kept in our mind before going for the preparation.
And what is the preparation strategy for the INASS surgical gastroenterology? What we should read, which book we should read, and for which we should give more importance?
Sir, first of all, we need to focus on the three things. The first one is the basic general surgery part, including trauma, endocrine part that cannot be missed, and surgical gastro part. So in surgical gastro, sir, NESS, if we go through the previous papers, NESS has a particular sets of topics and questions that are repeatedly asked in the each session of the exam. So we can easily predict that certain points or topics they will be frequently asked in the exam. Yes, sir. Like sir, they have put up questions. Most of the time they have put up the questions on the Whipple images. In each session they have asked on the questions of Whipples. Like sir, they loop. They have marked. There's in every session of the exam they just loop one of the vessel. We have to identify it, like whether it is renal vein, left renal vein, and supramesenteric vein, portal vein.
Common
In each
thing.
session, yes, sir. Yes, sir.
Okay. Then, I mean, how many questions usually they will ask from these kind of topics? Definitely, we could expect some 10 questions from these topics. Likewise, do you have any, I mean, things about these things? This topic you should not miss. Likewise.
So yes, I said there are few certain topics that are peculiar for the NESS section. They frequently ask on the PNET question, bile duct injury management, cholecystectomy management, and the they have the shunt questions and EHPVO management. They are the list of the questions. They said they put up question in each session of the exam. And said we have to do also previous year's question. This should not be missed because sir, hardly sir 7 to 8% will be come from the previous year exams.
Mm.
That are straight away a direct question that they put in the next section of the exam. Like I said, they put many times question on the LEAP protocol. There are more and many more other questions, sir. I am not able to recall right now. And even in the such basic general surgery part, uh, this time in the last session they have asked most of the questions from the Sebastian tables only.
Okay.
You don't need to go into the paragraph. There was a lot of questions this time, sir.
Anyway, so what about the importance of Blumgott or Sackleford? Or only we should stick on to the Sebastian daily?
Sir, I would like to say that, sir, if we talk about 2 years back, so it is we cannot miss this Bloomgard and the cycle forward, sir. So nowadays the pattern has been changed. So 30 to 40 questions came from the general surgery part, and sir, most of the question of the surgical gastro part can be managed by Sebastian only. So I don't think, sir, in this current period of time, we should go into the details of the Shackleford and the Bloomgard books. But sir, I have prepared for the 2 years, so I have gone through the Shackleford thoroughly, and I read Bloomgard selectively a few topics that was previously asked.
Okay. Like some surgeries for chronic pancreatitis, we
Yes, sir.
more elaborated in higher books, right? Shackleford or Blumgard than Sebastian.
Yes, sir. Sir, we can go through the tables of the Bloomgard only. That is
Okay.
enough for the
That is
exams.
enough. Okay.
Yes, sir.
Super, super.
And the
And
721 should be on the tip. Sir, 721 is like a crispy notes of both the books,
both
Shackleford and the
books, like
Bloomgard.
exactly.
So sir, nowadays we can uh, crack the exam by reading Sebastian Bailey thoroughly, sir.
Yes.
If we have enough time, then we can go for the Shackleford only, sir.
And Blumgard tables in addition to
Yes,
that.
sir. Bloomgard tables are enough to crack the exam, sir.
It's very good information for us. And how
Yes,
many
sir.
questions from the specialty, from the general surgery?
Sir, they put up questions mostly from the surgical gastro. 50 to 55% are from the surgical gastro,
Okay.
and hardly had 30% from the general surgery part. Because, sir, in general surgery part, there are few more questions from the gastro part only, sir.
Okay.
So it's a more weightage of surgical gastro. And sir, we should not we should not forget this endocrine part, because we have to go little into the endocrine part, because they usually ask the question little depth.
Yes.
Yes, sir.
And we will ask participants also to ask their questions. Divakar, will check any questions in the chat box. Okay. And how is the work pattern going on there? How many questions to attend? Dr. Divakar is asking. Sir, how many questions to attend? Because there is a negative mark now.
So we should try to attempt more and more questions in this ESS pattern.
Okay.
There is no place safe game in this ESS exam like
Okay.
NEET SS.
Okay.
To attempt more and more questions, sir, I have attempted 77 questions out of the 80 questions.
77.
77.
Okay. Okay.
Sir, we have to attend it. Otherwise, we will out of the competition, sir.
Okay. Super, super. Is there anything you corrected from your previous INASS exams? So I did this mistake in last exam. That's why I corrected this. I cracked this exam. Like, is any advice?
Sir, my advice, my advice would be, sir, just focus, just make your notes from the Sebastian. That should be the first book, and after that, if you have time, then make notes from the Shackleford. Notes should be crispy and concise. It should not be like we are making notes. We are making another book by making notes.
Yeah. That is
So
also
yes,
time consuming. It's very
yes.
difficult.
Notes should be crispy and concise, sir. So, like what I have noticed in your app, sir. Unfortunately, sir, I have joined your app very late in my preparation time. I have subscribed your app 2 months before the exam. So it was recommended by one of my study partner. So he was saying this was the good app for the last minute revision. So I have used it accordingly, sir.
Thank you. Thank you. And another question from Dr. Divakar. So also, which chapters are most asked, sir, and which ones to give more priority in order? Which chapters are most asked, and which what is the priority order?
Sir, basically, sir, in ESS questions, most of the questions they are asked from the hepatopancreatic biliary more
Yes.
than the luminal GIT.
That 55 questions, or I mean that
Out of the
specialty
55
part is
questions,
main.
out of the 50, sir, nowadays they have increased of questions on the liver transplant also. Lots of
Uh,
questions have been asked from the liver transplant, sir.
but only from Sabiston or these kind of books, not out of these books. Like
No,
recent
no, sir,
papers
no.
and all, they are not asking.
Yes, sir, I'm saying again, sufficient. If we go through the suggestion thoroughly for multiple revisions, we can able to crack the exam.
Okay.
It is not like, sir, it was 2 years back that we have to go through the Shackleford and the Bloomberg deeply, sir.
But on recent papers also they will ask usually.
Yes, sir.
Nowadays, Sebastian is enough. Thorough Sebastian Bailey is enough.
Yes, sir. And sir, do not. We should not miss the previous year exams. We should solve those questions, because that will help you in cracking exam.
And the other question is throw some light regarding general surgery topics, sir. What topics to be focused on? You already told, right? Trauma part and endocrine part. These are
Yes,
the
sir.
general surgery.
Yes, sir. Particularly if I talk about the endocrine part, we should go through the breast, parathyroid, thyroid, adrenals also. Sir, we have to go into the details of these topics, because they ask in the depth of these endocrine part. So endocrine section should be strong, along with the surgical gastro.
So Bailey and Sebastian is enough for general part also, right?
Yes, sir. Yes, sir. And in separation, if we go through the sir, tables only, na, that will be enough. Because, sir, since since 2 years, in the last two sessions, they are asking question on here and there to the question. So they have put up the question on the conditional essential amino acid in the April. Now they have slight change the question and they ask the essential amino acid. So their genre of question are quite similar. We can predict the questions after solving the previous year's question.
Same kind of questions, same kind of topics.
Yes, sir.
They are asking repeatedly.
Which are questions, they put up simple question from the general surgery part, but that question quite tricky and twisted. So we should spend little more time on this simple question. We should
Okay.
not take those questions very lightly.
Lightly.
Ki,
Okay.
oh, this is a question, we have to take it.
That is a thing we should practice more, MCQs more before the exam.
Yes, sir.
And we are planning for a live session next month for a period of around 30 days, 30 to 50 days. Live session mainly to focus on high yield topics of previous INASs of
Yes,
surgical
sir.
gastroenterology. And what is your thought? Is there anything? Please do this or something like that. Because previously we took a class with the name of compulsory revision program, which is only concised parts of all things, all specialties and general surgery. And now we are planning for only INASs, surgical gastroenterology, high yield topics for the next month. So, do you want to tell something, do this or don't miss this? Likewise, any advice for us, for aspirant team?
Yes, sir, definitely, sir. Sir, at my time, sir, when I joined your app, I have joined only general surgery part. Sir, at that time, I think there are no content available for the NESS. So, sir, I make general surgery part stronger by using those tables and also that I have seen in that app so that you have highlighted the important topics from the paragraph and you have compiled all the tables, summary box, charts in at one place.
Yes.
So that helps in sir quick revision of both the books in a short span of time. Sir, sir, I have done multiple revision by that app one day before the exam, sir, for general surgery part, sir. But sir, at that
Actually,
time there are no content available for the surgical gastro, sir.
okay.
So
We are planning for this and
yes, sir.
for INASs, mainly focused for INASs. So we should
Okay,
not
sir.
miss anything for the aspirant. That's why I asked anything we should correct or something. Okay. And any other questions? Is 2 months of duration ample for the preparation? Dr. D. To Dr. Garo.
I would say, sir, in 2 months of duration, we need to focus on the important topics only, sir, at this
Okay.
time. What they have asked in the previous session, just go through that. That will give you better marks. And
That's
extra
what we are going to do actually.
this we
For
can
next
do
month,
only in this short span of time.
that is actually our plan. So it's a
Yes,
last minute preparation. So we
correct.
should focus more mainly on last minute preparation,
Yes,
high
sir.
yield topics. What based on our analysis, based on what you told already, right? Hepatopancreatic biliary is the main part where what they are asking, like chronic pancreatitis surgeries, otherwise pancreas anatomy, GA trauma,
Yes,
and some pancreatic malignancy, whether cystic neoplasms or some other thing, and ramps, apple bite. These are the important topics.
yes,
Repeatedly, they are asking. Somewhere here they will ask ramps in option, otherwise in
correct.
question.
Yes, sir.
So some picture about Whipples. What is this structure? What is that structure? What is a procedure?
Yes, sir.
And likewise. So they are giving some CT picture of pancreatic mass, head of pancreas mass. They are giving absence as ramps. Ramps is mainly for the body and tail of tumor.
Yes,
So
sir.
that is an exclusive. Not true for that question. So likewise. So we are planning for that only for the next month.
Yes, sir.
So mainly focusing on the INASs, surgical gastro, important high yield topics.
Yes, sir.
So this is our plan.
Yes, sir.
So our image based questions asked sir from Divagar, from Dr. Divagar.
Yes, sir. Definitely, sir. They have put up question on image based. Sir, I have told one example that Whipple. Sure, there is one question will come in every session, sir. They just change the loop of the vessel. We have to identify whether it is left renal vein. There is no single exam, sir, that won't come with that image, sir. And they have some recently they have increased the images in the recent exams, sir. They have put up images on the shunt images, sir, like PSRS and DSRS, and you have to recognize, sir.
Which
And
is
what
in
are the
the
indications?
Sabiston, right?
Yes, sir. Sir,
The
it is
debate is in
given.
Sabiston, I think.
Yes, sir. Yes, sir. It has given in the substance, sir. But sir, the images were like interop images. So
Oh,
at
okay.
that time, we have to recognize on the spot, sir. So
Okay.
what is that? What are the indication of PSRS like this, sir?
And did they ask, replaced right hepatic artery from SME so
Correct,
far?
sir. Yes, sir. Yes, sir. They have asked many multiple times. Even in the interview, they have asked about this question, sir.
Okay.
Replace right hepatic artery, accessory left renal, accessory left hepatic accessory right
Image
hepatic
based
artery.
question or image based question?
Image based, sir. Image based. They have, sometimes they provide CT images also, sir. They have provided in April in ESS sessions.
Because that is a main problem with the uncinate dissection in case of so for that only we should go ahead with the CT images prior to Whipple's.
Yes, sir.
So because while dissecting the common hepatic duct, so likelihood of injuring the right hepatic artery. If we are not aware of replaced right hepatic artery which is coming from the SMA or from the celiac, and go ahead at the right side of common hepatic duct.
Yes,
So that is the main thing in CT images, preoperative CT images before going for the Whipple surgery.
yes, sir.
So uncinate dissection also, there is a right hepatic artery from SMA. That is a headache for the uncinate dissection. We should be very much thorough and we should palpate from our left hand. After thorough cauterization, we should palpate from our left hand. We should lift
Yes,
it. We should dissect likewise for the
yes, sir.
uncinate dissection. And I think replaced right hepatic artery is also a main favorite topic for them.
Yes. So similarly, in the luminal GIT, the inflammatory bowel disease, they are the most important topic that should not be missed. They have asked on the medical management of the pouch to identify pouch surgery, sir.
Okay. Pouchitis also they will ask, right?
Yes, sir.
Pouchitis,
Yes, sir. They will ask, sir.
like pouchitis. And what is a length of pouch or which pouch is more convenient or
Yes,
durable?
sir.
Frequency is less.
Yes, sir. Yes, sir. Sir,
And
and
anything we should read for from NCCN guidelines or TNM, especially for this.
no, sir. No, sir. No, sir. Sir, they don't put up more question on the NCCN guidelines, but that CA gallbladder staging is quite important, sir. They put a question on that, sir.
So post-op pathological staging. So what should we do further, right?
Yes,
Likewise,
sir.
questions will be there.
Yes. Yes.
Okay.
Sir, by
Okay.
by attempting the previous year's question, we can analyze the pattern of the question, sir, in the NESS. This is the good thing in NESS, sir.
Thank you, Gaurav. I think we took more time from you. Any other questions from the participants? Anything else you want to tell or want to, discuss? I think it's going to finish. Half an hour we took. And so 2 months is enough. We should focus on mainly important topics and we should revise it. Okay.
Yes, sir.
Any number based questions I will ask?
Yes, sir. Sir, they have increased those questions, sir. Percentage based questions, sir.
Okay. What kind of, facts or something? Percentage?
Sir, they have asked few questions, sir, but I'm unable to recall
No
presently.
problem.
But they have asked on the percentage based questions, sir.
No problem.
There were few questions.
You are also in that group, our
Yes, sir.
WhatsApp group.
Yes, sir. Yes,
So
sir.
whenever you are, recollecting those questions, kindly put it in the WhatsApp group. And one more question from the chat boxes. Sir, any book for previous year question papers?
Sir, there are no previous books, sir.
No.
Yes, sir. I have recollected those questions from here and there, sir, from multiple sources, sir.
Okay. Okay. Thank you. So I think we gave enough information for the aspirants and keep join with us aspirant desk and give your thoughts to for the class what should be done, what should not be done from your part. And we are expecting your support throughout.
Yes,
Thank
sir.
you, Dr. Gaurav. And thank you for your time, valuable time in between your schedule and all. You have to go to work or ward work or something. In between, you, spent your time for us, for the aspirants. It's very glad to hear. Thank you so much, Dr. Gaurav, and all the very best for your future achievements and all the best. Shall we wind up?
Yes, sir. Thank you so much,
Thank you,
sir.
Gaurav. Thank you so
Thank
much.
you.
Thank you.